Hi everyone, my name is Dr. Annie. I'm a board certified physician in internal medicine and obesity medicine, and I have with me here Dr. Asana. She's a psychiatrist and owner of Center for Mental Wealth. So we're going to be bringing awareness to mental health conditions, so just wait. Okay?
There's some show that exercise can work just as well as some antidepressants in some people.
If you have a doctor who's going to do a deep dive into your health, you find out that depression may be causing a lot of your symptoms. When it comes to burnout, I feel like as busy professionals, we're all dealing with it, right? It's something that just sneaks up on you. And I know that one of the symptoms of burnout could be anxiety and even depression. Now, how can we differentiate between real burnout and if you're actually dealing with a mental health condition?
That's a very good question because there's often an overlap between the two, and it's hard to identify it yourself. And to be clear, you may not be able to identify it on your own. You may need a professional to help you identify and to separate. I think one of the first things that we can do is to find out if we're able to separate ourselves from the stressor, right? To take a break, to have some time to take care of ourselves. Because a lot of times when we're burned out, that's the first thing to go. Because you're so worried about making sure that you get things done and fulfill your responsibilities. You're the last on the list, right? So self-care is so important. And if we're still noticing that we're struggling or we just don't have what we need to be able to take that next step, then it's time to talk to someone.
I think that's very important because as busy moms, as busy physicians, we often put ourselves last. We don't go for annual physicals. We just keep powering through all the fatigue. So being able to say, wait, am I dealing with burnout? Is this something different? And getting the help that we need, I think, is really helpful.
Yes, we can't pour from an empty cup.
Exactly.
So we have to fill up our cup first before we can help other people in our lives that we need to help. You know, like they say on the plane, you have to put on your own mask before you put it on someone else.
That's true.
So it's so important that we create that space to take care of ourselves.
Another thing that I see a lot is patients feeling like they don't have the outlet to speak about their mental health struggles. So how can loved ones identify that their loved one is struggling with anxiety or depression? What are the warning signs?
People may not come forward on their own, or they may not even be able to identify what's going on with them, right? And so sometimes if someone else can bring to their attention, it can help them to start to reflect on what's going on with them. For example, if you're noticing that they're withdrawing a little bit more, maybe they used to be more outgoing, but all of a sudden they're canceling plans, or they're just deciding not to come out or not to respond to your text messages or your phone calls, then maybe something may be off, right? We see changes in sleep patterns. Maybe they're staying up really late. They're not able to fall asleep as well. Or the opposite, they're sleeping too much. They're just tired all the time. That could be a change to notice. Another thing that people may not really attribute to changes are irritability and anger. So when we start to see someone is just irritable, they're starting fights over nothing, that could actually be a sign of anxiety or depression. There are many more things, but I think those are really important for us. If we notice that in someone that we love, to be able to approach them and say, hey, I've noticed this and this. What's going on? Is everything okay? Let's talk about it. How can I help? Right? And we can actually start that conversation and create a safe space so that the person feels like it's okay to talk about those things.
Exactly, without judgment. I think the judgment is what most people fear.
What issues do you encounter with managing a patient's weight as a result of their mental health?
That's a loaded question, because when patients are struggling with anxiety or depression, which are things we screen for when they come in for their initial weight management visit, I realized that it's more difficult to get them to comply with lifestyle changes, right? And no fault of theirs, obviously. When someone is very fatigued, can't get out of bed in the morning, they don't feel very motivated to go exercise. They don't feel motivated to meal prep and make all the nutritional changes you're suggesting. So when I see that, I definitely address their mental health conditions. If there's something that they need more support, I refer them to psych just to get a grip of their mental health, and that way I find out that we're able to actually make progress with their weight management. It's not just about giving meds, right? It's about managing the patient as a whole and just ignoring their mental health conditions. And every time they come see you, you're just talking about, oh, you haven't still worked out like I told you last time. No, you have to really understand why they're not working out. And that's what I try to do during my visits. I'm like, what are your challenges?
Yes.
What stops you from exercising? What stops you from eating right? I meet you where you are. And then I come up with a framework to really address your needs. And that's the only way we make real progress when it comes to weight management, because it's a complex issue. And doing it that way, and then plus or minus the medication, we see great benefits. So,
absolutely. So it's linked. It's very intertwined.
Lifestyle changes are hard. And so it takes someone being very committed to make those changes. Even taking the medication is not easy either. It takes a great deal of commitment to stick yourself every week, take pills every day to lose weight. So everything has to align for you to see success. So one big one that I see a lot is caregiver fatigue. You're spending your time caring for your family members who are dealing with a life-threatening condition, and you don't make out time to care for yourselves. And they come to me crying, saying, I haven't had a good night's sleep in months, and they're dealing with anxiety and depression. How can one set healthy boundaries even while caring for someone, so you don't lose yourself in the process and you don't feel guilty even when you set those boundaries?
That's really tough, especially if you feel like you don't have enough support to help you be able to create that space. So I think some of it really is what you're saying, is the guilt that comes along with it. The guilt of, oh, I have to be there 100% of the time, right? If I take a little bit of a break, it means that I'm failing in some way, shape, or form. But we have to go back to, if I continue to feel burned out, or if my mental health continues to decline, then I won't be here for a long time to help my loved one. So just reminding ourselves of the big picture and be able to create as much of a balance as we can. And then any time that we can get someone to help out, even for a little bit, for us to take some time away, can make a world of difference. I tell this to moms all the time, right? Especially new moms or moms with multiple kids, that you're juggling and balancing a lot, that it's okay when people offer help, take it.
Satana, this Mother's Day, I'm taking off. I'm going to go and stay in a hotel alone.
I love it. That's the way to go.
My doctor is people dealing with anxiety and depression and not wanting to take medications, because there's this stigma about that and how it affects the brain chemistry. So what's your take on that?
It's exactly what you said, which is stigma. Unfortunately, people have a different thought when it comes to mental health compared to their physical health. And they feel like it's some kind of a moral failure or some kind of a struggle of willpower if they're not able to fight through depression or anxiety, not realizing that it is a change that's happening in their brain. And sometimes we are able to work through it with lifestyle changes, which I always encourage my patients to do, because we have to look at the whole person and figure out what changes can we make to help us be healthier, both mentally and physically. Make sure that you're eating a healthy diet. Make sure that you are getting adequate sleep. I always tell people we want to aim to get between 7 to 9 hours of sleep every night. And then exercise. Exercise goes a really long way. Getting consistent physical exercise can make a big difference in our mental health, our energy levels, our focus, our motivation, help with depression. There are some studies that show that exercise can work just as well as some antidepressants in some people.
Oh, nice.
Right? And there's no side effects except some soreness the next day, maybe. But otherwise it can make a big difference. But sometimes even when people implement all of those things, they still struggle. And that's when medications can come in and can be tremendously helpful.
All right, guys, I hope you have enjoyed this conversation about these mental health topics. And if you're ever looking for a psychiatrist, go see Dr. Asana. She's awesome. She's the owner of Center for Mental Wealth, and she's taking your patients. And if you're ever looking for a primary care doctor,
go see Dr. Annie. She's here at Macie Medical.
Come see me, okay?
Yes, and she will take very good care of you.
Awesome. It's been a pleasure.
Toodles.